Visiting the hospital can be scary, especially for children, but there is support available at GBMC.
That's right. They have an entire child life program to help ease any fears. And today we're talking with GBMC Child Life Specialist Jennifer Seiler about how they can help. Welcome.
Hi, welcome. Thank you.
So first, what is a certified child life specialist?
Yeah, so our job is to help normalize the hospital experience for patients and families who have to come. And
Well, you were saying, who do you serve, though, when doing that?
Yeah, so we are primarily located in the emergency room inpatient unit. It's a combined care unit. So we meet families as they come in, and being in an ER can be very anxiety-provoking for both parties. So we work with, helping to lessen that anxiety for the patient and the family by showing them things they're going to encounter, such as medical equipment, or help the patient understand why they're there.
Really a bright spot in the time that's there. I mean, if you can find one, it's you.
Yeah, exactly.
Yeah, that's what I was. So what kind of things do you show the kids?
Yeah, so we use various different things to help make the hospital experience much more normalizing. So we use a lot of props such as a hospital buddy. So anything that a child's going to encounter can be done to the hospital buddy. So our little friend right here has an IV. So we will use real medical equipment to show the steps so they are familiar to the patient and to the family so they know what to expect. There's no surprises in the hospital, and they can actually place an IV before they get theirs. And then in doing so, we develop coping strategies. So maybe they want to watch the IV go in, maybe they want to blow bubbles, maybe they want to do an I Spy book with us. So the patient is developing a coping strategy while learning about what's going to happen at the hospital.
Got it. So not just another stuffed animal, but truly something that really goes to good use there. You have some other friends with you over there?
Yeah, so we also are supporting the pre-surgery patients, so kids who have to have surgery. So this is Hannah, and Hannah visits all the kids that have to have surgery. So same thing with the hospital buddy. Anything that's going to happen to them can happen to Hannah. In the surgery experience, we want them to become familiar with things such as the anesthesia mask. So Hannah can breathe in that anesthesia. We also help kids practice putting it on by using bubbles. So they'll put it on and then also blow. So it becomes a less scary thing and more fun. So when they see it in the operating room, hopefully they're familiar, they know how to breathe, they can practice blowing those bubbles. But yeah, so then we can practice Hannah, breathing in that medicine and then going to sleep. And then we have pom-poms that kind of represent tonsils that we can talk about how the tonsils come out. I'm trying to pull it out.
Look at that.
Yeah,
Okay.
so the tonsils are out, and then after our surgery, we wake up, and then parents will be there. So we kind of mimic the hospital experience through play.
Okay. And then you also have something else there on the...
Yeah, so we have tons of things. So this is an IV. A lot of kids think that the needle stays in. It's actually just a plastic catheter that stays in. So we talk about how this flimsy little straw stays into our body. And then we also make little squirt toys so they can squirt us, the nurses, the doctors, us. I've been squirted a lot, so it becomes a fun, non-threatening thing that's happening to them.
What kind of a response do you get from people?
So we have a lot of families, parents who are terrified of the hospital experience along with their patients. So we meet them and help, again, normalize and lessen their anxiety, make them feel more comfortable. When you are, less anxious and more comfortable, you're more easily to retain information, understand what's going on, develop those coping strategies. So parents and families become very thankful for us being involved to help make the hospital team, we're part of the multidisciplinary team, more welcoming. So we are helping the nurses and doctors do their job by making them less threatening people.
Well, you all do wonderful work, I have to say.
Thank you.
Yes, thank you for your services. And of course, we're gonna have more information on your website as well, so people can enroll in the programs.
Yeah.
Okay, great.
Thank you.